Hi, my name is Emma Hazel. Today I'll be giving you a tour of my OR design. When designing my surgical department, I focused on controlling the movement of clean and dirty traffic patterns. The book emphasized the importance of dividing sterile and contaminated work areas to minimize risk of surgical site infections. To reflect this, I decided to go with a hotel design plan that incorporates a clean central corridor to host the majority of the traffic, with a separate pathway for soiled items. Additionally, the department is divided into unrestricted, semi-restricted, and restricted areas, which also help control traffic patterns based on the jobs performed in each section. From the patient's perspective, they would first begin in the unrestricted areas. When the patient arrives, they will go through the registration process. The registration staff discusses the patient's medical history and insurance information with them, and then provides them with an ID wristband. From there, the patient is brought back to the pre-operative holding area to prepare for surgery. They will change out of their street clothes and into a gown or patient scrubs. Nurses will place IV lines and other monitoring devices needed during the procedure. Additionally, the circulator and the anesthesia provider will explain the procedure to the patient and conduct an assessment of their physical and mental health. Additional unrestricted areas include offices, locker rooms, and lounges for the staff, the control desk, and the PACU, which we will get to later. Since these areas are accessible to the public, street clothes are permitted. The traffic in these areas is monitored by the control desk to ensure efficiency and cleanliness. When the patient leaves the pre-op area, they are transferred along a clean corridor into the operating room. The corridor itself is a semi-restricted area, meaning that only certain people are allowed access. Authorized staff and accompanied patients are required to wear a surgical scrub suit, shoe covers, and a scrub cap. The patient is considered to be in a restricted zone once they enter the OR suite. The movement of personnel, supplies, instruments, and equipment is strictly limited, especially when a sterile procedure is in progress. Alongside wearing the typical OR attire, masks and other necessary PPE must be donned when a sterile field has been established. All doors within this area should remain closed to maintain a positive laminar airflow to prevent airborne bacteria from entering the OR. Additionally, the temperature should be maintained between 68 and 73 degrees Fahrenheit, and the range of relative humidity should be between 20 and 60%. The OR connects to other restricted areas, such as a scrub sink, sub-sterile work area, and a sterile storage room. The surgical team will use the sink located in the substerile room to scrub in and out of surgeries. Additionally, the substerile room contains an autoclave to quickly sterilize any contaminated instruments that are needed for immediate use during a procedure. The proximity of the substerile room to the OR, as well as the storage room containing frequently used instruments and supplies, is essential for minimizing delays during a procedure. Once a procedure is complete, the patient is brought out of the OR, through the clean corridor, and into the post-anesthesia care unit to recover from surgery. As mentioned earlier, the PACU is an unrestricted area, so OR attire is no longer necessary. The PACU is divided into cubicles to provide patients with privacy and to mitigate the spread of bacteria. Patients will stay in the PACU until it is safe for them to either be transported to another part of the hospital for further care or discharged back home. Before the patient leaves the surgical department, they will receive instructions to any follow-up or at-home care that's necessary for their recovery. And I can absolutely hear a chorus of people wondering, Emma, what happens to all the stuff that was used during the surgery? And what are all those rooms you didn't talk about? Well, I'm so glad you asked. Once a procedure is complete, the unsung heroes of our medical world swoop in and save the day. Environmental service personnel come into the OR to assist the surgical team with room turnover and the removal of waste and soiled linens. Additionally, all contaminated items are transferred from the OR into a semi-restricted area designated for dirty supplies and instruments. The reusable instruments will be taken to the decontamination room to be disassembled, cavitized, and sterilized before moving on to the assembly room to be put back together. After that, the surgical instruments are taken to the central sterile supply and processing department. Here, the instruments may receive a final sterilization before they are stored and processed. CSPDU staff will often organize the instruments into surgical trays based on the procedure they are used for. This department also processes instruments rented from manufacturers and keeps an inventory of the surgical department's supplies. Supplies and instruments are brought to the central storage rooms, otherwise known as the instrument rooms and supply rooms, and then the more sterilized stuff can go into those storage rooms right next to the ORs. And that would be my project. Thank you so much.